a burden, but it's not. It's what that makes you great. So being a pharmacist may sometimes stress us out, but these conferences will definitely make you unique and you'll find your own career pathways. Today's speakers of day three will be Dr. Michael J. Frugier, Dr. Arti Chandran, Dr. Mutishwaran. And today's session will be so much informative for you. Please make sure that your mic is muted. Give your reactions below that are really appreciated. So today, our first speaker is Dr. Michael J. Frudiger. He is a clinical pharmacist, clinical supervisor in St. Agnes Medical Center, California, sterile compounding pharmacy specialist and consultant, ASHP and Frudiger Pharmacy Consulting and Compounding and Regulating Compliance Supervisor, Children's Hospital, adjunct professor, clinical in California Health Sciences University, adjunct professor, AIMSI Graduate Institute. The theme on which he is going to speak about today is sterile compounding mastery, pharmacist strategic responsibilities. So let me introduce him to you. He is a registered pharmacist in California State Board of Pharmacy and Nevada State Board of Pharmacy, advanced practice pharmacist, board certified pharmacy therapeutic specialist, board certified sterile compounding pharmacist. He did his BS Genetic and Plant Biology in University of California, his PharmD in Thomas J. Long School of Pharmacy and Health Science University of Pacific, ASHP accredited PGY1 Pharmacy Practice Residency in Veterans Affairs Healthcare System, California. He has 50 plus publications in n number of certifications, and he is an advisory board member of Intravenous and Parenteral Nutrition Experts in Network of Gulf Region, editorial board member of the Saudi Journal of Clinical, California Health Science University, and Jan Valley of College, and he has lots of award been awarded very several times, and recently 2024 he is awarded at Steven C. Feldman Compounding Award, and he won the Preceptor Award of the Year in 2023 and 2024, and the Preceptor of Distinction in 2016, 2017, and 2018, and the College Honor Award in 2010, Nathan and Violet David Fellowship Award 2005, well, University of California College Honor 2004. His motive is to create impact by applying clinical skill, knowledge of technology, and innovative thinking to solve the problems and to give the higher potential. And today, there is yet more things to say about him. Hope this session will be super informative for us. We are so much privileged and happy to hear you in India, sir. Greetings from India.
Thank you so much for the kind introduction. Let me share my screen with you.
Yes, sir.
Can be seen okay?
Yeah, sir. Your screen is visible. You can go forward, sir.
Okay, excellent. Thank you. So thank you very much, everybody, for joining me and the privilege to talk about what I do as a compounding pharmacist. I have some learning objectives that I wanted to talk about. First is to introduce my professional experience and how I've gotten to where I am today, and also give you some background knowledge of what it is I actually do so you understand what I mean when I'm talking about it, and also give you some insights into the strategic responsibilities of pharmacists in sterile compounding. So there was already an excellent job in my background, so I don't have to spend too much time on this. But I've been around, I've been traveling, I've been fortunate to visit many people in the world to talk about compounding. Excuse me. So with compounding, there can be described in two different types of compounding: the non-sterile and the sterile. The non-sterile is what you might be more familiar with making creams and ointments and oral compounds, whereas the sterile would be a type of injection or other types of products that must be sterile. That is, and this how we make this is all governed by a chapter called USP 797. We make these sterile preparations inside of clean rooms, sterile hoods inside of sterile operating clean rooms to try to make sure that we make them as clean as possible. So when we do make these, we do have to have a certain type of technique, which we call sterile technique, and you can see here what it would look like, pulling it out from ampules as well as vials. And even though it's very simple to pull this liquid out from these containers, the problem is to make sure it's absolutely sterile and we're following all regulations to make sure that we're making sterile injections for patients. And then there's always problems that we have to identify. So whenever I'm in a clean room, I have to also educate staff to make sure that they're doing things correctly. So obviously this one's wrong. The staff's hand is blocking that air, and we call it first air, which is coming from the filter behind it. We want to make sure that filtered air blows over those injection sites that are going into the vial and ultimately into the bag. We also have problems here too because we don't want to put anything that required to be sterile in, being blocked. The syringes are too close to the filter. The vials have their stoppers that are blocked from other vials, and then we also have the caps that are being blocked by those vials and syringes. These are the chapters that we talk about when we talk about compounding. USP 795 is for the non-sterile compounding, 797 is for the sterile compounding, and 800 is for the handling of hazardous drugs. The USP 797 updated recently to 2023, and they did an excellent job in describing what is required in a sterile compounding process. The highlighted ones I list are what had the biggest improvements and the biggest changes overall. But as you can see here, it describes many elements in the compounding operation. And it's very detailed. It goes into two separate sets, as you can see. And then it also talked about the roles of designated person, which is essentially like a supervisor for the compounding operation to make sure that all of USP 797 and compounding regulations are followed. Oh, yeah, these are the items that must be sterile, and this is what we typically use in a sterile compounding room. So obviously the injections and infusions, but there's many other things that we have to be sterile too, like the irrigations for the internal body cavities, ophthalmic dosage forms such as injections and topical solutions, anything that's going to be inhaled deeply into the lungs, so such as a pulmonary inhalation. But if you're making a nasal spray that does not need to be sterile, however, I still make those in a sterile environment just to make sure I don't get the patient sick. The USP 797 does a really nice job also of describing what are the core skills of compounding. So as you see here, you've got hand hygiene and garbing, cleaning and disinfection and calculations. Aseptic technique is the big one. Achieving and maintaining sterility. So that's the maintenance of the clean room. We also have to certify the room and also have to, clean it on a regular basis using the right cleaning chemicals that must stay on the surface for a certain amount of time to make sure that they work correctly. So if I were to draw a picture for the whole compounding operation, I would put patient safety in the middle. And then what I value the most is the employee education. Finally, we have the quality assurance, regulatory compliance. Quality assurance is making sure that the tests are done right so that we know that our product is clean. The compounding process will involve the master formulas, which are the description of how to make everything. So you can just pull that up like a recipe book and see how to make it. And of course, the employee safety. With the handling of hazardous drugs, this is where I put the employee at the center because that's what this is all about. We want to make sure that we're not contaminating any staff while they are working. Employee education and the containment of the HD is the most important. There are many issues that evolve when things are not done correctly. So in this case, one drug as a paralytic was made in place of a drug that was antiviral, and the result was near fatal event. We have another one which was unfortunately fatal, where a paralytic, which is roperidone, was made instead of the seizure medication fosphenytoin, and then after the nurse administered it, she was working with other patients to come back, and the patient was suffocating. This case very tragic in 2006, very very well known. The uh, preparation should have been etoposide, which is a chemotherapy agent, and normal saline, which is 0.9% sodium chloride. But that day they were diluting to the more concentrated 23.4% with sterile water in order to make their own normal saline because there was a market shortage. And the technician did not read the label correctly, thought it needed to be full 23.4%. There are many reasons why she made the mistake, but the point is that people just need to read and also follow directions, and then need to have double checks, especially with certain high risk preparations. And unfortunately, the little girl lost her life. So when it comes to the designated person, this is what's described in the USB chapters of 797, 800, and 795, and 825. And it's essentially saying that you need an expert on staff to know how to do everything to make sure the operation is running successfully. Now, no one's an expert right off the bat, but you can start as a beginner and read everything from the USP, go to expert lectures, see beginning of the lecture like this, and that gets you on your way to becoming the expert. And the responsibilities, as you see, they must designate one or more individuals, doesn't have to be one, it can be a committee, to be responsible and accountable for the performance and operation of the facility and personnel um, in the preparation of those compounded sterile preparations and for performing other functions as described in this chapter. The designated person is also responsible for everything about the personnel training and evaluation. When I do this, I design the education course itself and then evaluate the staff and give them the grade, tell them if they have to redo it. I observe their personal hygiene and garbing, make sure that is incorporated into the training. And then everything else you see here, like facility design, I do it to help design clean rooms as well. And also how to observe their environmentals, how to check them to make sure everything is operating correctly. And then, are they certified every 6 months like they're supposed to? I also write the standard operating procedures, which is a requirement to make sure that those are followed. And that is the directions about how to run a clean room and clean everything, and also how everyone is supposed to be behaving. I also help with that quality assurance. If there's any complaint handling, then you have to remediate that. If there was a recall of sterile product, you have to follow along with that and make sure everything is pulled back. Um, I make sure that there's personnel qualifications for compounding allogenic extracts, if that's what they're doing. I also started doing that recently as the supervisor of pharmacy. And then also performance and operations of the facility and personnel must be evaluated continuously. So overall, the goal here is to make sure that patients are safe and that we deliver medications and healthcare in a safe and accurate way. And as you see, it involves a lot of knowledge base, which in order to be an expert, I had to read a lot and understand what that is and then implement that. And so right now for the two hospitals I assist to describe, which is Valley Children's and St. Agnes Medical Center, I am uh, the designated person, and I also assist other hospitals in doing this because I become an expert in the field. So I can teach them how to do it, how to manage themselves, and then it just overall increases the patient safety, which is the ultimate goal in those hospitals. And then that is the end of the presentation. So I left a little bit of time for the questions.
Thank you so much, sir. If you have any doubts, you can give it in the comments box or you can directly ask it to sir by unmuting yourself.
It looks like no questions for anybody. If I understand that correctly. So just remember, if you're looking into getting into sterile compounding, feel free to send me an email and also just look on the internet, try to find those USB chapters and begin to get educated. If you work in a hospital with compounding, go take a look at their operation to understand how they're doing it. And then if you have any questions about that, or if those staff need any questions to run through their operations, I'm available because I'm committed to providing patient safety for all places all over the world. So thank you very much.
Thank you so much, sir. Thank you so much for giving your valuable time and sharing with us. We are grateful for you. Thank you so much, sir.
All right, thank you.
And now we are moving on to our second session. And today, our second speaker will be Dr. Arati Chandran, who is a pediatric and neonatal clinical pharmacist at Ramakrishna Hospital, Coimbatore, Tamil Nadu. The theme that she'll be sharing us with me today is pediatric pharmacy specializations and finding your niche. She did her PharmD in Ramakrishna Institute of